Good afternoon, friends, and it's time again for our Facebook Live. And today we have Dr. Suresh Ramasubban, Senior Consultant, Pulmonary and Critical Care Medicine at Apollo Hospitals, Kolkata. And today's topic, an interesting one, it's called walking pneumonia. So, the first question that comes to us with this topic is what is walking pneumonia?
So walking pneumonia is it's in the lexicon of common man's dictionary, but I don't think it's a good term for us. It just means a pneumonia which is not severe enough to put you in bed or put you in a hospital immediately. But it's just another community-acquired pneumonia. That means a pneumonia which is acquired while you're in the street, while you're walking around. But it's not that severe that you get prostrate and you get on bed and you can't get out, or your fever and chills are not that severe, but it's still a pneumonia. It's a community acquired pneumonia of lesser severity, and what we say is it's caused by probably atypical organisms rather than a typical bacterial pathogens which cause the pneumonia, which can cause you to be seriously ill.
So, what are the common symptoms of walking pneumonia?
So pneumonia means that is something which affects your lung parenchyma. Pneumon, it's a Greek word which signifies lung. So pneumonia means that it's going to affect your lungs. And the cardinal symptoms of any affliction of your lung, especially if it is an infection, is that you will have fever and cough. So fever and cough has almost about an 85% sensitivity. That means 85% of patients with pneumonia will have fever and cough. Yes, you can have the remaining 15% who have a pneumonia on an X-ray or on a CT scan of the chest may not have fever and cough, but fever and cough forms the predominant symptom. The other symptom which is very common is breathlessness or shortness of breath, and people can also feel a little bit of chest pain, which is we call as a pleuritic chest pain. That is a pain that is on either side of in either lungs, either side of the chest wall, which increases when you take a deep breath. So that's typically what we call as a pleuritic chest pain. So fever, cough, shortness of breath, pleuritic chest pain, and then the typical constitutional symptoms whenever you have any infection is that anorexia, that is not feeling like eating, a little bit of nausea, a little bit of feeling lack of appetite. All these things are what we'll call as a constitutional symptoms that will accompany any illness.
People are aware of something called bronchitis. How different is walking pneumonia from bronchitis?
Bronchitis and pneumonia, for a clinician, it's almost the same. So, bronchitis can be of two types: an acute bronchitis and a chronic bronchitis. So, chronic bronchitis is predominantly what we see in smokers, or what now we call a better term for it is a COPD, or chronic obstructive pulmonary disease. That means you have productive cough for greater than 2 months, for greater than 3 months for 2 consecutive years. That is called as chronic bronchitis. While acute bronchitis is cough which is predominant and associated fever or breathlessness, just like the symptoms of pneumonia. But the difference is that if you were to do an X-ray, you would not find any abnormality on the chest X-ray, or if you were to put a stethoscope and be examined by a physician, you will not have any findings which is suggestive of pneumonia when we put a stethoscope on somebody's chest, or when we perform a physical examination on somebody's chest. So for a person who is having symptoms, it's not possible for you to distinguish as a patient, as a client, or as a person to distinguish clinically bronchitis and pneumonia. For you, the symptom is fever, cough, breathlessness, and which will be present in both this category of patients. So it is obviously the physical examination and the doctor's evaluation which tells us whether you have a pneumonia or a bronchitis. So the cornerstone of making this distinction is obviously going to be a chest X-ray or a scan of the CT scan of the chest, which will confirm whether you have a pneumonia. That means something which is affecting the lung parenchyma, that is the alveoli and the lung structure of the lung, versus something. Bronchitis means the bronchial pipes, the pipe which conveys air from the outside into your lungs. So is it something which is afflicting your windpipe, which is going inside your lungs, or is it something which is affecting your lungs? Has to be distinguished clinically and radiologically. Clinical, for a patient, it's impossible to tell, is what I would say.
What causes walking pneumonia?
So walking pneumonias are, as I said, a form of pneumonia only. It's a milder variety of pneumonia, as I just mentioned in the beginning, that is a pneumonia caused, which is not putting you down immediately. But yes, so the organisms we say typically cause pneumonia are divided into two categories: a typical organism and an atypical organism. The typical organisms are bacteria, and these are typically, one is a gram-positive bacteria, which is classically known as Streptococcus pneumoniae. That is why the term pneumonia, the commonest pathogen that causes pneumonia is a bacterial species called Strep species, which is named as Streptococcus pneumoniae because it causes pneumonia. The second is obviously Haemophilus influenzae, for which now all our children are getting vaccinated, so we see less and less of Haemophilus influenza related pneumonia. And the third is organisms like Moraxella catarrhalis, which are again gram-negative bacteria, which are resident of our throats and so on and so forth. These are the typical bacterial or pathogens which cause pneumonia. The atypical organisms include what is called as mycoplasma and chlamydia. These are atypical, where they are not typically virulent bacteria, and that is why the pneumonia that they cause is considered a little walking pneumonia, because they don't cause the same symptoms of high grade fever and getting your blood pressure to be down and not getting you into shock state, which can happen with a streptococcus pneumonia. It doesn't happen with these two. So the two main and the most now important, I would say, an atypical organism to cause a walking pneumonia is actually in the present generation in 2020 is nothing but COVID. So a virus, influenza used to be the number one which will cause a walking pneumonia. So viral pneumonias are what causes a walking pneumonia, where a lot of patients would just have fever, cough, feeling unwell, constitutional symptoms, and have influenza. And yes, and similarly, so right now it would be COVID. So a lot of people will say their oxygen level, we call this happy hypoxia or silent hypoxia, where you've gone to such a low oxygen level that you're not able to perceive that, and you're just having fever and cough, and obviously that's other symptoms of lack of taste. But viruses would be one big cause of walking pneumonia or an atypical pneumonia as compared to the typical bacterial pneumonia.
I'm sure there are certain risk factors which are associated with walking pneumonia. If you could please elaborate on this.
So atypical organisms, as I mentioned, like mycoplasma and viruses like influenza, adenoviruses, now the coronaviruses, all these afflict two groups of people in particular, that is less than 2 years of age and more than 65 years of age. So that is the one group, two sets of people who are predominantly afflicted by these atypical organisms. So generally, most of us in the middle aged and in the young adulthood and up till 65, which we still call as young adulthood now, would still probably be not affected that much with these things. So these are the two things which are, age is probably the number one thing. So then obviously then immunosuppression like diabetes, which is the commonest cause of being immunosuppressed in our country, would be the second thing that would bring it. Other immunosuppression because of chronic kidney diseases, because of taking steroid medicines, because of other immunosuppressive therapy which is being used for arthritis and other immunosuppressive condition is what will predetermine you or uh, predispose you to get a walking pneumonia.
What is the treatment for walking pneumonia?
Okay. So treatment for walking pneumonia, as I said, is mostly it's viral or it's mycoplasma. So we concentrate on trying to treat the mycoplasma, which is the commonest cause of a walking pneumonia. So these are generally what we call as as I said, the atypical organism, and they respond very well to simple antibiotics like doxycycline, which get prescribed orally, and or atypical other antibiotics like azithromycin and erythromycin, which are the macrolide group of antibiotics. So the macrolide group of antibiotics, doxycycline, these group of drugs do very well. It is the penicillins like the amoxicillin and the ampicillin which don't treat this. So it is always that is why when people don't get better with a pneumonia, we always add a doxycycline or azithromycin or a clarithromycin or any of the macrolide group, or a quinolone like a levofloxacin or a moxifloxacin, which will cover for these atypical organisms. Obviously, viruses are a completely different thing. The antibiotics have absolutely no role in treatment of viruses. We have to understand that 35% of pneumonias are caused by viruses, and we have some medicine antivirals for COVID as well as influenza, but antibiotics do not have any role to play in the treatment of a viral pneumonia. So as I said, majority of the walking pneumonias would be viruses, and we don't probably require any treatment other than plenty of fluids and rest, and we should be ready to go after that.
Can people die from a walking pneumonia?
Yes, despite the term that it's a walking pneumonia, we get a lot of questions. আমার patient তো হেঁটে এসছে কেন খারাপ হয়ে গেছে? So it is like with the COVID that we see patients walk into our hospital and saying that they are fine, they just have a little loss of taste and smell, and then we really cannot do anything. It's your body's own inflammation sometimes that gets you, sometimes it's the viral multiplication. So similarly, mycoplasma can cause a significant morbidity and mortality also if untreated and if undiagnosed. So yes, these are, yes, the term walking pneumonia, the real reason why this term is that, yes, you can probably walk it out. It's just that it's something, it doesn't put you down too much, but it does give you a morbidity of a cough and cold which will last for more than 10 days, 14 days, and you will be in trouble. But yes, if untreated, if unrecognized, if elderly, more than 65, younger than 2 years of age, if you have immunosuppressed state, these can also become very virulent and can also cause death. So this walking pneumonia, that's why in medical terms, in our textbooks, we desist from putting these words. We call it as an atypical pneumonia. We don't call it as a walking pneumonia anymore anywhere. So this is a terminology. The walking pneumonia terminology is a is present only in the patient's lexicon. It is not present in our dictionary anymore. So we are very categorical and clear that any pneumonia can be severe, can be life-threatening, and should be taken care of. And we advise to all patients that you should take immediate attention. So bronchitis, pneumonia, sometimes it's a continuing spectrum, sometimes it is not. We really need to focus on that and say, okay, I have a problem, especially if you're above 65, any fever, cough which lasts more than 72 to 96 hours, we would always advise that you take medical attention and have a low threshold for getting a chest X-ray done to assess what is happening, and have a still, as I said, antibiotics are not essential, but have a low threshold for getting your blood count done and your chest X-ray done, and then subsequently, based on the physician's assessment, an antibiotic which will cover these atypical organism, as I mentioned, is what needs to be done.
Thank you, sir, for sharing your thoughts and discussing at length with our audience here. I'm sure they'll have more questions and we'll get them answered. Till the next time we have you for another session, thank you so much from our audience here as well as the Facebook team. Thank you, sir.